How anxious is your dog? Does your dog have canine anxiety disorder? This is the fascinating conversation that we're going to have with a very special founder. I've been getting to know Dr. Casara Andre. We've been chatting for the last little bit about the problems that you see and the solution that you see under this sort of header of canine anxiety disorder, but it goes much deeper than that. This has been such a fascinating conversation. I said, I have to get you on. We have to start talking about this and explore this further. Dr. Casara, thank you for joining. As always, lovely to see you.
Thank you so much. I am so excited to chat about this topic. It's my newest nerd focus. So I'm excited for this.
We're all nerds at heart. Okay. So you are a founder, and obviously you're a doctor as well, veterinary medicine, but you're approaching it from a founder perspective of problem solution, right?
Yes.
This is not just what I want to do, but we're working on clearly articulating, especially for all the pet owners out there, the dog owners, problem solution. So give me the pitch. What does this mean? What is the problem? And what is the solution that you're proposing as a founder?
I am interested in working on the problem of emotional disease in animals. Canine anxiety disorder kind of gives me a specific target, and it's the animal that's a little bit easier to work with. But from a bigger problem perspective, emotional disease, particularly among mammals, but my patients, animal patients, is really what I think the problem that I want to focus on is. If you look at emotional disease in humans, the numbers are staggering. There is 1 in 8 humans is a number that is put out by World Health Organization, has 1 in 8 humans has some type of mental health disorder. And I think I've got another number here, 52.9 million people. But here's the kicker, in 2020, so before a pandemic, right? So numbers now, that kind of just gives you an idea of, we probably don't even recognize what that is. So humans, yes, but as a veterinarian, I'm really interested in what the consequence of human emotional disease is on my patients. So how that can bleed over into the animal side. So the problem that I'm actually working on is emotional disease in animals. And we have some numbers and around that as well. Just to give you one, canine separation anxiety disorder, so separation when the human leaves the home, that's gone up, some numbers say 700% over the time of the pandemic. So we're talking huge, huge numbers in terms of problem size.
You are saying that our dogs experience separation anxiety, and that is an emotional disease.
I'm saying that it is one of a type of emotional disease. So you can have dog reactivity, you can have human stranger reactivity, you can have anxiety for phobia, noise phobias, sound phobias. Separation anxiety is something that has really come up after pandemic. Ed, have you sort of heard in human world like COVID children who were born in pandemic, and so they just have different social skills than children who were socialized at a young age? Well, it's something that we see on the veterinary side as well. COVID puppies is a thing. Puppies that were not socialized. Yep.
They
absolutely.
Talked about corona babies and different things like that. Okay,
yes.
But now I'm just going to go after the elephant in the room here, because as a founder, and we record these so that founders of all different types of startups can kind of learn, you are taking a foray as a medical practitioner with doctor title into sort of this risky territory of blazing, pioneering a new frontier, offering some unique, innovative, possibly disruptive solutions. You're taking a bit of risk. So let me point this out. We could conflate mental health and emotional disease the wrong way. We could interpret it as, if we have mental health problems or a mental health condition, that's not a disease. Like, it seems tricky. So how about you explain, like, how do you differentiate, or how would you explain to someone who said, wait a second, I have a mental health issue. That's not a disease. Is it a disease? Like, how do you explain that?
Yeah, amazing question. And again, thank you for letting me be a nerd because I'm happy to talk about why I think it's a disease. And I'll do it from a patient perspective because that's really where this started for me, of me seeing something in my patients that I didn't have a solution for. When I think about emotional disease in an animal, really the thing that makes it sit in the disease category is that emotion, fear, anxiety, reactivity, can result in the inability of me to give appropriate medical care at the appropriate time. So other diseases can be complicated because you can't medicate the animal, you can't draw blood, you can't perform a procedure, as well as we know it in humans too, but again, humans, animal patients being my focus, we see stress, anxiety, cause a lot of immune system disorders. We can have hyperreactivity. In a lot of my seizure cases, we see anxiety be a factor that really amplifies a seizure condition. So when you look at, in veterinary medicine, emotion of the animal, you really see it be tied quite closely to other diseases and the primary cause of some diseases now. And especially with this particular point in time when we have so many animals affected by anxiety, you really just see the patterns in a way that we probably didn't recognize prior to COVID pandemic. But now emotional disease in animals is really beginning to overwhelm veterinary resources. It is a huge problem in our world.
That's fantastic, because one of the important parts of being a founder startup is to show investors or your stakeholders, hey, this is an underserved problem. This is a growing problem. There's a big enough market for it. And you're saying that as someone with domain expertise in the area, you are starting to see the issue of emotional disease start to ramp up, which would be very interesting for a lot of investors or other people might want to get involved, going, huh, I didn't recognize that, which was my reaction when you explained it to me. I thought to myself, wow, that's a unique and novel insight that I didn't consider. And that's the best part about talking to founders such as you.
Well, if I can just add, the reason that I think it's really important to approach this from a entrepreneurial founder perspective is this cross species potential sharing of an emotional disease. So how humans and animals, so mammals, just focusing on mammals for the moment, how our shared spaces and our shared emotional states might actually be contributing to disease on both sides. So from an investor perspective or just human interest, there's also issues around medical support animals. So if you are a diabetic, if you human are a seizure patient and you have an animal that is your medical support animal, it means that they are very closely paying attention to your physiology and your emotional state. And if they then are not able to do their job of, Ed, your blood sugar is changing, you should go test, you should eat. Like that's what these animals do for the humans that they take care of. If this animal's ability to serve and care for their human is compromised, then we begin to see public health risk on the human side. So it really is a cross species problem. But the fact that we're veterinary medicine and human medicine, we often don't talk. And so that's why I think it's been important to approach this from a very founder perspective so that I can talk about a family unit rather than it just being the dog's anxious. Okay, no one cares. And really how it might be impacting human health and be a public health risk as well.
It comes full circle. I think that's really unique as well, because we talk about, well, recently, just going through our global events, how a disease can go from an animal into people. And you're talking about from an emotional standpoint. So let me try and illustrate this out. I was in a relationship once, and my partner had lost her father at a very young age, and she was given a dog, and that dog became her best friend. It was like a therapeutic animal. I don't think she would have made it through her grief without having that animal. She bonded. Now,
Mm-hmm.
if her dog wasn't available to her, wasn't the kind, supportive, protective creature that it was, and I experienced this because I spent many years with this dog. If the dog was aggressive or skittish or different than that, that dog wouldn't have had the same impact on her life, wouldn't have saved her life if that dog was experiencing an emotional disease or some type of contagion. So there's the one example. Now let me go to another example. Imagine, okay, so I grow up and I have parents, and let's just say they're dealing with their own emotional disease. There's an emotional contagion that goes through
Hmm.
between the parents and the children. They have their own mental health challenges, something like that. And I grow up and that affects the way that they parent me.
Yes.
And therefore I develop something like, say, an insecure attachment style, avoidant attachment style, things like that. Then if I try and raise an animal, I could pass that on to my animal, and that my animal, my dog, will reflect those maladaptive behaviors that are seen through me. And now I passed it along, this emotional disease. It's become an emotional contagion. That's how
Yes.
I'm picturing it right
Absolutely.
now. Okay.
Absolutely. Absolutely.
And you're seeing this in your patients right now.
Yes. Yes, 100%. One of the things that gives me a really unique perspective on this is my history of being a veterinarian. I was a veterinarian for the military early in my career. So canine PTSD and human PTSD, and then how we use canine, like how those intersect, is something that I have a lot of personal ties to, as well as a lot of professional interest. And so now, as PTSD in humans is receiving a lot of attention, there's a lot of amazing research, a lot of breakthrough therapies. There's a lot more conversation around therapy dogs and therapy animals and how they're used in context. But what I see from my practice perspective is the animal almost receive the impression of the human's PTSD, and the human will be better. They will go through therapy or receive a modality of healing, but the animal continues to have the symptoms of PTSD. And we don't really do anything about that from the veterinary medicine side because we haven't really looked at it as a problem before. So I think there's some very obvious examples of that emotional contagion, as well as how is that animal now able to support their human when they're suffering the same symptoms. I mean, that's a dichotomy between healer and patient, or caregiver and patient. Just you can't everyone be sick. That's just a really hard thing to get out of when everyone has the same type of disease.
Again, another novel and unique insight. And we know how much people love their pets. So if,
Hmm.
pet owners understood possibly what their animals are going through, because that's how we learn, like, we know animals are mammals are emotional, type thing. So what's the solution? Give us the pitch. What are you proposing?
The solution that I'm proposing, or really the hypothesis, it comes down to some science that we are also beginning to learn, endocannabinoid systems, some of the modalities, some medicines that are emerging. So looking at this from a different perspective, my hypothesis, my proposal is that instead of treating each symptom, so the downstream effect of the problem, we really look at some of the root causes. And instead of desensitizing the animal to every thunderstorm or exposing them to all these types of stimuli, we really begin to think, can we use a different emotion to cure some of that emotional disease? And this is just biology and medicine concepts in general. When we have a bacterial infection, we use an antibiotic. Like we already think about how to cure other diseases by matching what's wrong or thinking about the system that's affected. So on the emotional side, the solution that I'm proposing is that we use the emotion of curiosity to circumvent, to go around, essentially create an isomorphism of that disease condition to give the animal an alternative, like, oh, maybe the world isn't as bad as I thought. So reintroducing or reteaching the emotion of curiosity to mammals that have emotional disease, my hypothesis is that that is curative.
Okay. You are definitely pushing the boundaries here. Okay. Let me break this down. Let me reflect back to you. It makes sense because instead of white knuckling your way and trying to fix problems the way that we typically do, we have to, fix these and address them at the root cause,
Mhm.
like psychology. Let's go deep in your childhood and let's address all this stuff that's going on. You're saying, hey, we don't have to do that. We can, inject the emotion of curiosity, and that everything else will take care of itself. In many
Yes.
ways, it's kind of like, my 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 emotional relationship with food, type thing. And if I focus only on, oh my gosh, I'm a terrible eater, and I get all wrapped up and I make myself anxious about it, versus, hey, what's something else that I could focus on, such as experiencing food in the joy of people instead of trying to
Yes.
control my diet, things like
Yes.
that, then my diet should naturally take care of itself, type thing. That's similar in my mind. That's the parallel. But you're going to have to come with a little more. And, it's kind of like my challenge, throwing down the gauntlet. Where have you developed this thesis from that curiosity, the emotion of curiosity, could cure emotional disease?
And that's really the key point. Why that emotion? Because there are a lot of other emotions, and in a lot of other areas of medicine, we may use other emotions to kind of get around a situation. But why curiosity? I want to throw one just idea into the conversation that's really important here. My patients are nonverbal. So many solutions on the human side that are effective. It's not my scope of practice to comment on those, but they're very reliant on the ability of verbal communication and of same species, same cultural context working through. And so you said it yourself of let's talk through that. Let's get to the problem. Let's think about what happened. Many times in veterinary medicine, we have no idea what happened to that animal. Just because because I can, I'll list off a couple of the patient groups that I'm interested in working with. So canine PTSD is a very big interest of mine, but there are also a lot of animals that have been victims of sexual abuse. So they have been abused by a human in a sexual context. These animals end up in shelters or are taken away by animal control. We have no idea what happened to them. So if we approach this from a desensitization perspective, it's not possible. So that, I think, is one reason that I feel very confident about trying this hypothesis, because for me, the solutions that are now being offered on the human side, they're not applicable. It doesn't do me any good to continue to pursue that line of consideration of, let's talk about it. How do you feel today, pup? I have to look for a different solution. But veterinarians are trained in translational medicine. So cross species problem solving is something that we do all the time. And so looking for a solution that's not obvious is just kind of in our blood and bone. So for me, curiosity is really the piece that allows an animal to approach something that's scary in its own time. So I can have an animal across a room and I can put something very scary in a box. So a mouse or a dog that hates, it doesn't matter what it is, something very small, very scary, way over here, but it's safe and there's distance and it's not going to be interrupted. I can give that animal the opportunity to be curious about, what is this? I haven't seen it before. And then in that distance, give positive reinforcement of just go look. Maybe it's entertaining. Maybe there's food. Maybe it's bad, but maybe it's good as well. And so that's the piece that I really love about the protocol that I'm working on. It's not, animal, you will endure the sound until you no longer are afraid of it. That's really traumatic. And that doesn't always go in the way we want it to. But if you give an animal space and the room to consider what it may or may not want to do, we can be a lot more effective. And I'm going to try to change my sound for just a quick second and take this off. Sorry.
See this works. Okay, how is that? Can you hear me okay still?
Yeah, it's the same.
Okay.
Now I watch YouTube videos of foster parents. So they take these animals that need rehabilitation. I see a lot. I see tender, loving, I'm just going to let you just stay on the couch. And, then they do things like they kind of just introduce them to a leash and they put it on and they take it off and, different things like that. And, it always amazes me how much loving care. And I fundamentally can see how pet owners, if their dog has emotional disease and they're not in that position where I'm in the role of rehabilitating this animal, they can get quite frustrated with their animal. How come my dog's not complying or listening, all that stuff. So they don't go and take that position with the animal. So in many ways, I think that the same way that animals can get our dogs can get the emotional disease, we as animal owners, as the dog owner, we have to take a position of curiosity as well. Like, how does that work?
Yes. I'll share a couple of phrases that I hear from a lot of my clients just to demonstrate the frustration that comes to that human component of the family unit when their animal is dealing with an emotional disease. The phrase I hear the most often is, I didn't expect it to be this hard. I feel overwhelmed by all the bits and pieces that I need to think about as a human to keep my animal safe. So you see a pet parent struggling with, I want to create a safe space for my animal, but I literally can't leave the house. If we go back to separation anxiety is one of the problems. I can't walk out the door without my dog screaming at the top of its lungs and the neighbors all being upset, destroying the house, eating something it shouldn't. There's a lot of life disruption that happens when anyone, human or animal, has emotional disease. But in a family unit, when that animal has emotional disease, you have a bite risk for the children or the humans in the household. You have danger to the other animals, the housemates. Life routines are disrupted. So that's a really big piece that I hear a lot from my pet parents. I didn't expect it to be this much. I'm feeling really overwhelmed. And as you know, from your work with joy in people, that feeling of being overwhelmed, that's not a place where you can be creative in a solution. That's not where you're going to have good problem solving from. But if we can introduce, my theory, the curiosity between those two species, can you and your animal explore something together? Not only are you working on repairing the bond that had some trauma from whatever this emotional disease was, but for both organisms, you're finding a solution that's going to work for that family unit. And I think that's a really important piece of what I want to present in this protocol is family unit focused. If I just give a pet parent instructions, you need to dose your animal 4 times a day. You need to be home to give him his medications. You need to make sure that there's no disturbing sounds, thunderstorms. You cannot live in a state that has thunderstorms. It's not possible. However, if I can help them find a solution that comes from inside their family unit that works for them, that's inherently going to be sustainable.
But you're saying, if I take this to somewhat of a logical conclusion, is that our dogs could be a mirror reflection of our own emotional disease that we passed on. It's kind of like, raising children. So I got 2 boys, 17 and 15. And, they've got their mental health challenges, but they're like full-length mirrors of my own stuff that I passed on to them, my emotional legacy. So it's crazy because the shame you experience as a parent going, these are my children, I'm going to screw them up for life. Like, this is my emotional legacy. This is my one shot. I'm supposed to be good at this. I can't screw this up. And you freeze. Like, there's fear, there's shame, there's guilt. There's so much, sense of hopelessness at times. So, how much do you experience that with pet owners where you kind of point out, hey, maybe your pet is reflecting some stuff in your own life, and what are their reactions? What's been your experience with something like that?
That is such an amazing question, because that feeling is reflected from pet parents as well, particularly in the pet parent who really sees that animal as the child in their household. And that really is the culture of a lot of households now. They may not have human children. That animal absolutely holds that same place in that family unit. And even if it's not that degree, there still is absolutely that guilt, the shame. I don't want to hurt my animal. I don't want to have something that I'm going through affect my creature that I love. So, well, first I'll just share a story from my own life. My cat, which just, no one watches her clip. I mean, I am a veterinarian. I can tell what's going on when I can pull her blood myself and run it in my own clinic. Early COVID, just so much change in schedule. I was actually home more, but I had to rearrange my office so that I could be on video call. I was looking at a camera versus at her whenever I was. There was so much change. And she does have emotional disease. She develops phobias really easily. And her emotional disease is her biggest medical problem. she went into renal failure. I had everything that I needed to be able to make sure that she was not affected and was as aware as I could hope to be about how my emotional state was affecting her. It still affected her in a really, really negative manner. And I'm fortunate that I was able to start her on medications and get her fluids and really jump into action. But it was absolutely from the stress that was happening in my life reflected on her, even with the degree of awareness that I had.
Wow. Okay. Okay. Then so, when I look at your work, I see the words cannabis, psychedelics,
Yes.
emerging medicines for
Yes.
emotional
Not all
dysregulation.
solutions. So
Yes.
amazing.
Like I see the medicine of wonder. So how does the medicine of wonder, psychedelics, cannabis, all that stuff fit in to what you got going on?
Yes, the medicine of wonder is my name for the protocol itself. And I've tried to make it very simple because I want it to be applicable regardless of the family unit, regardless of the situation, regardless of the animal itself. First is to remove the fear posture. We see this in humans as well. If you are in your physical body in a posture that is not able to look around and receive new information and be joyful, you see that reflected in your emotional state. Sitting at a computer all day, we know how it affects our spine. We know how it affects our nervous system. We know all these pieces. Same thing from an animal perspective. Almost all of my really severe anxiety cases, they look like a fear posture. Does that make sense when I say that, Ed? So the tail tucked, weight back on hind legs, sort of ready for something to be bad. I'm going to react really fast, not even actively fearful or anxious, but in their physical body, they're ready for something to be wrong. And so we see in the nervous system a increased reactivity. Hypervigilance is a thing that we see from everything's going to be bad, right? So the fear posture itself, the memory of pain that created that initial posture, or here's a big thing in animals, a painful body that continues to get hurt. So a new puppy comes into the home. The older dog really, really is painful. And every time the puppy tries to play with it, it hurts. And so you see that fear posture just really become embedded in the emotional state. So heal the fear posture. And that's really where you see my work in cannabis and emerging medicine, psychedelics. On the human side, we see amazing research results in terms of healing pain, reestablishing balance in the endocannabinoid system, rewiring some circuits in the nervous system that we didn't even know were possible. So my work there and kind of those modalities really focuses on how can we reset this body and set it up for success. So heal the fear posture. Oh, I'll pause there for comment.
So you're saying we can use these emerging medicines to put us in a place where we're ready to undergo the process that you're talking about.
Yes. And again, because I need to reserve space for myself to be a nerd, I talk about the medicine of wonder, but I'm also really interested in what I call the science of calm. There are some amazing mechanisms in the endocannabinoid system. And this is since the 1980s. Like cannabis endocannabinoid system is new to science and medicine in and of itself. In this system, we finally understand some of how the body actually achieves homeostasis, how it tells itself, I'm actually okay. I can tone it down. But when that system is not working, we see anxieties ramp up, we see seizure disorders ramp up. So there really is a new piece of science that lets us as medical practitioners understand how to arrange a system to be able to achieve calm, if that makes sense.
I want to just completely reinforce that. There's new science that I'm watching come out that maybe all these issues are not always psychological. If we address the biological, systemic issues that are happening at that level, everything else takes care of itself. So let's just get your brain healthy, and then the psychology will, correct itself, which is an amazing part of the body and what have you. Now, and I also confess, and this is, I'll make this confession for all the people going to watch it. I was totally anti-cannabis until I met Dr. Casara. Casara, what you did is once you showed me the science, and you did it in such a way where it was approachable and it wasn't political in any way or all that stuff. And I looked at science and you made it approachable for me. I went, holy cow, I didn't know this about cannabis and actual biology and how it work in these new discoveries and all those things. So I'm all for what you have to say. Tell me, you have to be experiencing sort of this polarization between groups of people who are completely embracing it and then other groups of people who are like, you're so bad, I can't believe you're going to turn my dog into a stoner. I'm not a stoner. Like, what are you saying? Like, there has to be like a political response to your work, or are you just, bulletproof and you haven't experienced any of it? Like, what has been your experience?
I'm pretty bulletproof.
Okay, nice. Good
Well,
to know.
I will say that I consider it a personal and professional skill that I've worked on a lot throughout my career to help a pet parent have an idea for their animal's health. So whether this be a difficult conversation about health and well-being towards end of life, euthanasia, palliative care, or puppy care, and you should exercise, like part of being a veterinarian and caring for a family unit is making it possible for that family unit to exist together. So many times there is education that needs to happen, changing of a paradigm that Dr. Google doesn't always know what's right or what's best, and really focusing on the patient. So I find that I am able and well positioned to speak, as you said, from the science of, we know this, it is well researched. Let's figure out what it means for you, instead of, you should use cannabis for your animal. Many times my clients come to me and say, hey, I heard this was a thing, or I've used it for myself, or someone told me I should, and I'm not too sure. Can you tell me what you think in the guise of being my animal's advocate? That's all I want to know. I don't care about the politics. I don't care. I just want to know, does this help me care for my animal? And so then it allows me to speak from the research side, from my clinical experience side, just from the heart perspective of, I hear what you want to do for your animal. Let's figure it out together. So yes, there are very, very, very polar ends of this conversation, and psychedelics is going that same route as well. But really, when you love an animal and you know what that means to have an animal in your family unit and really care for them, it is the veterinarian who you bring those questions to. And it's part of that skill set to be able to digest it all and kind of come up with a solution.
And it's that love and care that propels the pet industry. It's recession proof because of our bonds with animals.
Yes.
And your ability to empathize with pet owners and people who are, like, in my position, might have been reticent or a little old fashioned, in terms of thinking. The ability to empathize and to make it approachable, and focus it on the love and care that we really want for animals and for people, I think it's one of your unique superpowers. So I fully endorse what you have going on. Let's talk about how you structured your startup. So let's get into the nitty gritty of the business. We kind of set the stage. Here's another website.
I want to say the other two steps of my protocol.
Oh yeah, please do. Yeah.
So heal the fear posture. But yes, I think that's the most exciting because it lets me work with cannabis and eventually psychedelics. But second is establish communication. So again, my patients are nonverbal. So consent is a really big piece that we need to tackle ahead of time. That in a human, informed consent is a big thing, but how do you do that for a nonverbal creature who someone else, a human, is making that decision for them? So in animals, we actually have some easy ways to do this, and they're called stop-start behaviors. We see it in cooperative care. We use it a lot in zoo animals, where you're not going to force the elephant to do something. You really have to involve that animal in their own care. So making sure that there is some type of communication, some type of consent. And then the last one being actually to teach curiosity games and to make it here's the thing we're going to work on. Instead of doing physical rehab exercises, you're coming to see me and we're going to exercise your curiosity with your human, and let's see how it goes. So that's actually the protocol, the three-step pieces of it.
Let's summarize. You're not just saying, I just want to sell a whole bunch of, edible cannabis edibles for animals. Correct. Type thing.
Correct.
Right. You're saying there's a full protocol,
Mm-hmm.
right? And there's 3 steps to it. And then it culminates with games like, it's really a lifestyle. It's a behavioral change for the pet owner and the animal itself.
Correct. Absolutely.
All right. And I'm pointing out these websites because I'm going to include the links for everybody who's watching this so you can explore Dr. Casara's world. Here's another one of her websites, Advocating for Animals in the Emerging Psychedelic Research, Medical, and Legislative Ecosystem. So there's advocacy involved as well, because this is an emerging, policy-driven industry. There's regulation. Here's the Medicine of Wonder, and this really breaks down your whole thesis on the Medicine of Wonder itself, and you've added the science of calm to it. This is your advocacy part. So explain, what is your business model? So what are you trying to launch? Like, what is your MVP, if you will, your minimum viable product in terms of prototyping, getting out there, making money, getting traction? What do you got going on?
So I am already offering consultations in this. Essentially, it has been my career, all of my career, but having a specific protocol that I can begin to break down into steps for pet parents. Really, I need to get to the pricing part of it. What I think about now, it costs about $5,000 to get an animal through the procedure, meaning they meet with me a couple of times, they meet with my tech a couple of times, we send them to another specialist if we need to work on seizures, or just to get this body lined out and begin using the tools that we have. But that's out of reach for a lot of people, especially when I think about shelter animals, and it needs to be refined in a way that makes it much more accessible. So I am taking clients, I see consultations, I can do them virtually, so able to consult globally. And that's really what I'm working on at the moment, of taking this bigger idea that I see absolutely work in my patients every day. But how can I streamline it so that it's not just, you have to come see me, but it's actually a protocol that I can disseminate to other veterinary practitioners, maybe even start implementing at animals' young life stage so that we actually create resiliency instead of having to deal with emotional disease later.
Ooh, that's big. That's big. Let's be preventative. Let's get it into
Absolutely.
our children ahead of time.
Absolutely.
All right. So let's pull out some principles here for other founders who are doing different sorts of things. Your protocol is your product,
Yes.
right? So I got a problem. My protocol is the solution. It's turned into a product. Now we're going to wrap it around a business model. Right now, what you're doing is to gain traction and validation. Obviously, customer discovery is a little more straightforward with you because you're already entrenched. You're already, practicing veterinary medicine. So now you're validating the idea, you're testing out, and eventually it's going to become its own scalable version. But right now you're in hand-to-hand combat, you're delivering it manually, and you're learning a lot about what your product is and does, and what we call those moments of truth or market truths, when someone experiences your product and they have a moment where they say, this is so valuable for me, this is solving my problem. You're experiencing that doing manual consultations right now, but your plan is to really expand it so that we get this out there. It's not everybody has to come see you, but we can incorporate this everywhere, in shelters, other practices, different clinicians, nonprofits, organizations, groups, anybody who wants to do this, as well as possibly self-serve when it comes to someone coming online and saying, I want to learn this. That's what you're going for.
Yes, absolutely. Right now, it's me doing all of those steps, which, really contributes to the price. But many of these are things that a trainer can do, a technician in a clinic can do, a pet sitter should be doing whenever they're coming over to the animal's house. Like it really has the potential to be broken down into little snippets, just like resiliency in humans, that you can implement at any point in time, so that it's, one, you don't need the intervention to be as dramatic as whenever I get involved, or as often as if I get involved now. You just, in my world, that's what I consider scalability, because my goal is essentially to not have a job, to have all the animals healed in the world. So I'm not really trying to go for big, even though it needs to go big first. But the goal is that everyone can take care of their own animals. But there's a lot to be done in the meantime.
And the best part is you're making money right now. You're consulting, you're generating revenue. And, once again, I'm going to pull out the principle for other founders. is if you have an intellectual property or a methodology that is your product to solve a problem, and you can deliver it via manual consulting and generate some money before you go out and build software or invest in all this scalable infrastructure, do it. It's just going to be so much easier. What have you learned by delivering it manually? What are some insights where you kind of thought, oh, this experience has informed how I'm going to develop the product in the future, or I didn't expect this to happen? Like, what are some lessons or moments that you've taken away from going this manual consultation route?
That I need a waiting list.
Which is a great sign.
Yes. So there's not a single conversation that I have, either explaining what I'm working on, talking to friends, at someone's dinner party, that there isn't someone who says, that for me, my dog, or my brother's dog, or my wife's dog. It just is. Animals are throughout our lives. Humans rely on animals for so much of our well-being. Industrial use animals, they're just present in our world. So when we think about emotional disease and its prevalence and begin to see its impact just across the board, that actually is the thing that I've learned the fastest in this. Is I need to be really, really steady on my boundaries and make sure that there is a place to put a waiting list. And then also really starting to ramp up training my staff, my technicians, to be able to take some of those pieces, just because the need is tremendous.
Great sign. That's called finding problem solution fit, where people are running to you and saying, thank God someone is solving this problem. I've been struggling with it. For all other founders out there, and I know, Dr. Casara, you're not interested in going the VC route and what have you, but that's traction. That if you can show investors, listen, I've hit a nerve, there's a waiting list, and if I can actually get to this waiting list, I'd make this amount of money and all that stuff. Tell me, how are you planning to fund all of this? Because you're going to need money to get this out there. What are you doing?
Well, consultations in and itself is a great moneymaker. I mean, it's just, there is such a need, but it obviously relies on that service provider, me being the one providing it. So education is always the piece that I go with next. If I learn something, to disseminate it to my colleagues, other veterinary professionals, not only does it reach the ultimate goal of this just being more available, but it also allows me to have passive income while doing that, as well as give my colleagues a chance to explore it on their own and then ask a question, so that when I am talking to somebody, it's really specific, really targeting the problem. They're stuck and we have a solution. So it, again, makes it cheaper for the pet parent and the professional that, let's talk for 30 minutes versus me working with you for 6 hours or multiple times over the month. So education, passive revenue is a great piece for us, but we also really are. So part of what I do, I have a couple of businesses that contribute to this. One is a massage school. So we teach therapeutic massage, which is a part of protocol of removing the fear posture. The cannabis consulting business is global. So we work around the world talking about cannabis. Psychedelics is just beginning to emerge. And so Veterinary Psi is the company that we've stood up for that. And we have a nonprofit, Care for the Healer, that while it also yes, it is for healers that are humans as well. But again, just from the animal focus, animals are healers. And I think that anyone, you mentioned a couple of your stories, I see it all the time. We include animals as what this nonprofit's caring for. So the nonprofit has an innovation program where we are targeting doing some of the research ourselves. So from that perspective, that's really where we're trying to raise money. The others are doing well. It's easy to consult, it's easy to stand up education, but from the research side, that's really where you need a lot of capital all at once to be able to start some of the studies.
Okay. What are you working on next? What's the next milestone to continually expand and achieve the strategic objectives of your startup?
Research the effects of MDMA in canine PTSD. And the reason I say that one specifically is because of how well poised that question is to be answered. If anyone's been keeping up with the MDMA research on the human side, there is groundbreaking work for treatment-resistant PTSD to gain resolution. So resolution, right? Cure. And that's so different than what we've had before. The research there is amazing. But once a molecule, MDMA, has gone through its phase 3 FDA trial, and the trial is just completed for those, so should be prescription before too long, it's easier to do that again in a different situation or in a different animal. So by taking the steps that have already been done on the human side, MDMA for human PTSD, we can more easily change that question to MDMA for canine PTSD, as well as much of the clinical research has been done in animals for these human clinical trials. So we already have a lot of the safety information. Looking at the landscape, and there's a lot of stuff we like to research, that one is the one that really pinpoints a lot of questions all at once that we feel gets us to that next stage.
I can't stress enough for founders that market timing and being opportunistic is so important. We know that MDMA in general has been such a hot topic, and it's gaining steam. I think I'm paying attention to it more, one, because I know you, so I look for this stuff, but also it's coming up more.
Yes.
Just in general, and general media and things like that. We don't know, there's always a subculture that's going on, but when it becomes mainstream, that's when you want to pounce. So sometimes you just have to wait for that opportunity for the market to avail itself to give you that opportunity. All right, so we have a few more minutes. I'm going to pose a scenario. People who are watching this, I know we got lots of pet owners out there, right? They're founders, entrepreneurs, like my audience are founders and entrepreneurs and professionals, but they have pets. So I hope that the founders and entrepreneurs take away the lessons, and they can kind of take the principles of what you're doing and apply it in their own business if it's not related. But as pet owners, what would you like them to do? What would be your invitation after watching this in terms of either interacting with you, or what could they do themselves? What advice would you give?
Evaluate your family unit with some objectivity. And that may be the hardest piece to do, but the thing that is most impactful from my ability to help or to say, yep, this protocol is going to work for you. Journaling is the most keystone thing that any animal lover can do to help see if their animal is dealing with anxiety and they haven't recognized it, see how that family unit is interacting. So what I mean by that is it can be as simple as a sheet of paper on the fridge, and think about 2 time points in the day that you're just going to look at your animal and say, I think you're at 10 out of anxious right now. What time is it? Are you about to feed them? Did someone just come over? Start looking for patterns in your life, in your animal's life, because when you then come to me with your journal, I can look at that and see the patterns that you might have missed. Wow. Versus many people come to me in a consult now, the first 2 weeks are go home, set up a camera while you're not there, see what your animal's doing when they're home alone. What sounds are they reacting to? Are they nervous? Are they sleeping? Are they tearing stuff apart? And give me a journal. So really, if anyone who feels they have an animal who might have emotional disease or is just curious to know what's going on, some type of consistent pattern seeking is the best thing you can do to recognize a pattern yourself, but then also really sets you up for success anytime you're working with a medical practitioner down the road. Doesn't matter who it is, me, your veterinarian, whatever. It is such an impactful action to take.
Wow, that's amazing advice. I just thought of something that sort of gets me excited, but not sure I'm going to test it with you. Are there any apps or anything out there that help you create a journal with your animal?
So there are on the human side. I have yet to find one that I love on the animal side, but there are some up and coming entrepreneurs who are really trying to change the way research is done on the cannabis side. So making it very patient focused, tailorable, customizable from the practitioner's perspective. So I do think some of those are going to emerge, but you really don't see the veterinary aspect. You see us try to change what the humans are doing and kind of clobber it together. I'll tell you what I would love to have. Some app that randomizes the time that you look at your animal. So animals find our patterns so easily. So if I check on my animal 4 o'clock every day. The animal's gonna be like, yes, I'm here. Were you checking in on me? Versus if I had something that could just easily, like an Apple Watch app that would just ping me random times throughout the day. And my responsibility is when it pings, write down a number, write down a color, whatever I decide to do to say, how's my animal doing? That would be so useful to me to be able to see the patterns versus having to dissect human, which is your pattern and which is actually the animal's pattern, and how are y'all intersecting?
I see a startup in the making.
Yes.
Founders, you've heard it here first. You only have to give Dr. Casara a portion of your company for revenue, things like that. I'm ready to go out and do it myself, or give you a pile of money so you can go do it.
There you go. There you go.
I think that's such a novel idea. And again, that's the insight
Yes.
of, we normally do it on a certain schedule, but doing it randomized gives you such better data.
Absolutely.
I love it. And then if you make it easier, like a coding or code system to be able to do that, maybe take pictures and amazing. Okay. So I'm going to plug. I'm going to say in the description, I'm putting all of Dr. Casara's websites, and then your LinkedIn is okay. Can people find you on LinkedIn? Right.
Absolutely.
Contact Dr. Casara, no matter what you're all about, even just to, encourage her and let her know you're tracking on what she's doing. But obviously you're such a collaborative person. You want to empower other people who are interested in this space. It can't be just you that does it. You're not trying to like lock it all into some secret formula. You want to get it out there. This is open source is really what we're getting at. What final encouragement would you have, or what's the last thing you want to say to everybody who's going to be watching this?
I am so excited to be alive at this time in the world. I think this is an amazing, mind-blowingly spectacular time in science, in medicine, in humans' ability to problem solve, and looking at solutions from a different perspective. I think we won't recognize the world in 10 years. All of the things that seem so impossible right now really just take a lot of people collaborating together with a compassionate heart to see past. And I think that from that, let's look at our animals first. It allows us to step outside of the human brain where we're like, I can't see the answer. It's just, it's not working. But when we look at a different species, when we look at a brain that's just a little bit different and really have to come at it from a nonverbal, compassion-led, curiosity and joy perspective, I think it's going to show us answers that we wouldn't have thought of otherwise. So be encouraged, because I can't even begin to imagine some of the discoveries that we're going to see over the next couple of years.
Couldn't have said it better myself. Thank you, Dr. Casara.
Thank you.